Back pain has lots of different causes and therefore has lots of different treatments. And the trick is identifying what the cause of the back pain is. So, for example, if it's a disc herniation that's causing back pain, that would put you towards one path of treatments. Whereas if it was a muscular cause, then that would point you towards a different type of treatment. So the challenge that I face as the clinician is the diagnosis as to what the most likely pain generator, as I call them, are, and be that all of the various components of the spine, which is a complex structure or anatomical structure, and therefore that is what takes the time and the investigation to establish. There are a variety of different treatments for back pain, and again, depending on the cause, and that varies through simple observation and keeping mobile, all the way through to more involved procedures such as injections, with physiotherapy as well involved in the treatment of that. Occasionally, with certain types of pain generators, there will be the opportunity to perform a nerve type block or a nerve type procedure. With some episodes of back pain, it can be necessary to provide almost a fire break or a stop to that pain episode, and injections can provide that interlude for physical therapists to get involved, or more manipulative treatments like osteopathy or chiropractic. And so I sometimes utilize injections in those domains as well. A lot of lower back pain can't be permanently treated, and it's about making the patient more comfortable and more aware of how to manage their back pain. Sadly, there's no cure, and actually the majority of us will suffer some episode of back pain during our lives as a product of how we live our lives, of our anatomy, and also the relatively sedentary lifestyle and demands that we place on our spines. It's more about trying to make sure that a patient can cope with their back pain and getting them out of the really severe pain that they're in, and making things more manageable to return them to normal active lives. Sadly, there's no guaranteed surgical solution for back pain, and therefore surgery is usually reserved for very specific indications. Those are actually very rare, and the majority of patients have what we tend to call non-specific back pain, which can be musculoskeletal in nature or can be of a different origin. But surgery itself as a treatment for back pain sadly doesn't have the best of outcomes, and therefore is reserved only for very isolated and specific sets of circumstances. There are lots of good ways of helping to manage your back pain at home, and the majority of these cases do settle down on their own. A really important part of it is staying mobile, staying active. That often isn't what a patient wants to do when their back is painful. They feel like lying down and keeping still because it's the only comfortable position. Sadly, that leads into a vicious cycle where the back then stiffens, and then any further movements are even more uncomfortable. So trying to stay mobile little and often is really important. Leading an active lifestyle is also a useful thing to do. And so regular exercise, staying active. If you are sedentary for a long period of time at work, sitting in front of a computer, which a lot of us are doing at the moment, working from home, making sure that you set yourself an alarm for every hour or so to get up, do some stretches, walk around and move around to keep that back from stiffening up. Because in a seated position, you do generate a lot of stress across your low back, which can aggravate any pre-existing problems you might have.